Question 31. Nurse Jenny is instilling an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? A. Pulling the auricle backward and upward. B. Warming the solution to room temperature. C. Placing the tip of the dropper on the edge of the ear canal. D. Placing the client in a side-lying position. Correct answer, C. Placing the tip of the dropper on the edge of the ear canal. Question 31. Explanation. The dropper should not touch any object or any part of the client's ear. Don't allow the dropper tip to touch the ear, fingers, or any other surface. It could pick up bacteria or other germs that can lead to an ear infection. Question 32. Nurse B should instruct the male client with an ileostomy to report immediately which of the following symptoms? A. Absence of drainage from the ileostomy for 6 or more hours. B. Passage of liquid stool in the stoma. C. Occasional presence of undigested food. D. A temperature of 37.6 degrees Celsius. Correct answer, A. Absence of drainage from the ileostomy for 6 or more hours. Question 32. Explanation. Sudden decrease in drainage or onset of severe abdominal pain should be reported immediately to the physician because it could mean that obstruction has been developed. Sometimes the ileostomy does not function for short periods of time after surgery. This is not usually a problem, but if the stoma is not active for more than 6 hours and the patient experiences cramps or nausea, he may have an obstruction. Question 33. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? A. Intestinal obstruction. B. Peritonitis. C. Bowel ischemia. D. Deficient fluid volume. Correct answer, B. Peritonitis. Question 33. Explanation. Complications of acute appendicitis or peritonitis, perforation and abscess development. Diffuse peritonitis and sepsis can also develop, which may progress to significant morbidity and possible death. Postoperative abscesses, hematomas, and wound complications are all complications that can be seen after appendectomies. If the wound does get infected, one may grow bacteroides. Recurrent appendicitis can occur if too much of the appendiceal stump is left after an appendectomy. Question 34. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? A. Myocardial infarction. B. Cirrhosis. C. Peptic ulcer. D. Pneumonia. Correct answer, D. Pneumonia. Question 34. Explanation. A client with acute pancreatitis is prone to complications associated with the respiratory system. The relationship between Mycoplasma pneumoniae infection and acute pancreatitis has been debated in the literature. In 1973, Mart et al. Reported 4 adult cases of acute pancreatitis following pneumonia due to MP. In 3 of the patients, the pancreatitis occurred in the 3rd week after the onset of cough, by which time the respiratory tract symptoms had almost disappeared. Question 35. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? A. Watery stool. B. Yellow sclera. C. Tarry stool. D. Shortness of breath. Correct answer, B. Yellow sclera. Question 35. Explanation. Liver inflammation and obstruction block the normal flow of bile. Excess bilirubin turns the skin and sclera yellow and the urine dark and frothy. After 3 to 10 days, the urine darkens, followed by jaundice. Systemic symptoms often regress, and patients feel better despite worsening jaundice. The liver is usually enlarged and tender, but the edge of the liver remains soft and smooth. Mild splenomegaly occurs in 15 to 20% of patients. Jaundice usually peaks within 1 to 2 weeks. Question 36. Marco, who was diagnosed with a brain tumor, was scheduled for craniotomy. In preventing the development of cerebral edema after surgery, the nurse should expect the use of A. Diuretics. B. Antihypertensive. C. Steroids. D. Anticonvulsants. Correct answer, C. Steroids. Question 36. Explanation. Glucocorticoids, steroids, are used for their anti-inflammatory action, which decreases the development of edema. Corticosteroids produce their effect through multiple pathways. In general, they produce anti-inflammatory and immunosuppressive effects, protein and carbohydrate metabolic effects, water and electrolyte effects, central nervous system effects, and blood cell effects. Question 37. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should A. Increase the flow of normal saline. B. Assess the pain further. C. Notify the blood bank. D. Obtain vital signs. Correct answer: A. Increase the flow of normal saline. Question 37 Explanation: The blood must be stopped at once, and then normal saline should be infused to keep the line patent and maintain blood volume. Treatment is to stop the transfusion, leave the fourth in place, intravenous fluids with normal saline, keeping urine output greater than 100 ml/hour. Diuretics may also be needed and cardiorespiratory support is appropriate. A hemolytic workup should also be performed, which includes sending the donor blood and tubing as well as post-transfusion labs, see below for a list, from the recipient to the blood bank. Question 38. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? A. A history of high-risk sexual behaviors. B. Positive ELISA and Western blot tests. C. Identification of an associated opportunistic infection. D. Evidence of extreme weight loss and high fever. Correct answer: B. Positive ELISA and Western blot tests. Question 38 Explanation: These tests confirm the presence of HIV antibodies that occur in response to the presence of the human immunodeficiency virus, HIV. When there is a possibility of acute or early HIV infection, the most sensitive screening immunoassay available, ideally, a combination antigen/antibody immunoassay, in addition to an HIV virologic, viral load, test is performed. RT-PCR-based viral load test is favored. A positive HIV virologic test generally indicates HIV infection. Question 39. Nurse Maureen is aware that a client who has been diagnosed with chronic renal failure recognizes an adequate amount of high biological value protein when the food the client selected from the menu was: A. Raw carrots. B. Apple juice. C. Whole wheat bread. D. Cottage cheese. Correct answer: D. Cottage cheese. Question 39 Explanation: 1 cup of cottage cheese contains approximately 225 calories, 27 grams of protein, 9 grams of fat, 30 milligrams cholesterol, and 6 grams of carbohydrate. Proteins of high biological value contain optimal levels of amino acids essential for life. In general, proteins from animal sources have a higher biological value than proteins from plant sources. Animal sources of protein are meat, poultry, fish, eggs, milk, cheese and yogurt, and they provide high biological value proteins. Question 40. Kenneth, who was diagnosed with uremic syndrome, has the potential to develop complications. Which among the following complications should the nurse anticipates? A. Flapping hand tremors. B. An elevated hematocrit level. C. Hypotension. D. Hypokalemia. Correct answer: A. Flapping hand tremors. Question 40 Explanation: Elevation of uremic waste products causes irritation of the nerves, resulting in flapping hand tremors. The classic description has been in hepatic diseases, but other causes can commonly cause asterixis, including azotemia and respiratory disease. Asterixis is a disorder of motor control characterized by an inability to actively maintain a position and consequent irregular myoclonic lapses of posture affecting various parts of the body independently. Question 41. A client is admitted to the hospital with benign prostatic hyperplasia. The nurse's most relevant assessment would be: A. Flank pain radiating in the groin. B. Distension of the lower abdomen. C. Perineal edema. D. Urethral discharge. Correct answer: B. Distension of the lower abdomen. Question 41 Explanation: This indicates that the bladder is distended with urine, therefore palpable. In the elective setting, the examination should include abdominal examination, looking for a palpable bladder/lung pain, and examination of external genitalia, meatal stenosis or phimosis. Benign prostatic hyperplasia, BPH, refers to the non-malignant growth or hyperplasia of prostate tissue and is a common cause of lower urinary tract symptoms in men. Question 42. A client has undergone a penile implant. After 24 hours of surgery, the client's scrotum was edematous and painful. The nurse should: A. Assist the client with sitz bath. B. Apply warm soaks in the scrotum. C. Elevate the scrotum using a soft support. D. Prepare for a possible incision and drainage. Correct answer: C. Elevate the scrotum using a soft support. Question 42 Explanation: Elevation increases lymphatic drainage, reducing edema and pain. The penis should then be placed upward on the lower abdomen, to limit any downward curvature of this penis postoperatively. Scrotal support or tight mesh underwear may be used after the sterile dressing is removed. Question 43. Nurse Hazel receives emergency laboratory results for a client with chest pain and immediately informs the physician. An increased myoglobin level suggests which of the following? A liver disease. B. Myocardial damage. C. Hypertension. D. Cancer. Correct answer, B. Myocardial damage. Question 43. Explanation. Detection of myoglobin is a diagnostic tool to determine whether myocardial damage has occurred. Myoglobin, an oxygen-carrying protein found in cardiac muscle and striated skeletal muscle, presents an attractive alternative to CPK and LDH in the emergency department setting for identification of acute myocardial infarction. Myoglobin levels may be elevated in the serum within 1 hour after myocardial cell death, with peak levels reached within 4 to 6 hours. Question 44. Nurse Maureen would expect a client with mitral stenosis would demonstrate symptoms associated with congestion in the A. right atrium, B. superior vena cava, C. aorta, D. pulmonary. Correct answer, D. pulmonary. Question 44. Explanation. When mitral stenosis is present, the left atrium has difficulty emptying its contents into the left ventricle because there is no valve to prevent backward flow into the pulmonary vein. The pulmonary circulation is under pressure. Mitral valve areas less than 2 square centimeters causes an impediment to the blood flow from the left atrium into the left ventricle. This creates a pressure gradient across the mitral valve. As the gradient across the mitral valve increases, the left ventricle requires the atrial kick to fill with blood. Question 45. A client has been diagnosed with hypertension. The nurse priority nursing diagnosis would be A. ineffective health maintenance, B. impaired skin integrity, C. deficient fluid volume, D. pain. Correct answer, A. ineffective health maintenance. Question 45. Explanation. Managing hypertension is the priority for the client with hypertension. Clients with hypertension frequently do not experience pain, deficient volume, or impaired skin integrity. It is the asymptomatic nature of hypertension that makes it so difficult to treat. Monitor and record BP. Measure both arms and thighs 3 times, 3 to 5 minutes apart while the patient is at rest, then sitting, then standing for initial evaluation. Use correct cuff size and accurate technique.